Yeah, and Ravinaka to everybody, and good morning all. I must say that it's with great pleasure and gratitude that I have been asked today to come and stand on behalf of the Ministry of Health and Medical Services to inaugurate the capacity building for disease surveillance and training and response training in Fiji. I've just looked through the program on some of the presentations, and apparently we are covering immunization, COVID-19, healthcare facility-related infections, and healthcare-associated infections. All of these topics are indeed relevant to us today. There are many lessons that we are still learning from the last epidemic, and immunization has been the linchpin of our response to COVID-19. So, first and foremost, I want to express our heartfelt appreciation to Koika for their continuous and unwavering support over the years. Your dedication to our nation's development and well-being have been nothing short of exceptional. Through your generous donations and funding, you've been a driving force in strengthening Fiji's public health infrastructure and preparedness in combating infectious disease and health threats. The capacity building for disease surveillance and response training marks yet another milestone in our partnership. The program is designed to enhance the knowledge, skills, and capabilities of our healthcare professionals, public health officials, and relevant stakeholders involved in disease surveillance and response efforts. We aim to empower our first responders in the front line such that we can ensure swift and effective response to any health crisis that may arise. At this point, I just want to digress a little bit and just speak to our participants. One of the issues that we've always found with regards to disease surveillance is that too many times we compile the data and send it up. I'd like to see a small transformation where we compile the data, do some response. When you send up the data, you're sending up together with your initial response plan. That is actually how we need to do surveillance. You detect early, you start your response early. The people at the top, they won't do anything. They only need to know what you have already decided to do. Our job is just to coordinate, get the various functional units talking to each other. But it's not our job to set up your plan for you. Your job is to put together the surveillance plan and then start the initial action before we put it together before a more broader action plan. The objectives of this training are indeed ambitious, yet essential. We seek to establish an effective crisis management system through innovation in infectious disease management, governance, and policy coordination. This will enable us to be better prepared to face any unexpected spread of infections and other health crises. We also aspire to activate global public cooperation system, working hand in hand with international partners to respond effectively to health emergencies. Much as we are seeing today, Koika is bringing in an international partner to work with us. They're bringing in their consultants to work with us to help us strengthen our public health system. Through training, we will engage in learning the early detection system and operation methods for crisis situations. Integrated monitoring and information analysis of infectious disease will be the core of our preparedness efforts, ensuring that we are equipped to detect and respond promptly to potential outbreaks. Moreover, this training endeavors to establish a communication channel that fosters trust and empathy between our people. Transparent information provision will be the bedrock of our approach, enabling us to keep public informed and engaged, thus strengthening our collective response to health challenges. And I must admit that one of the biggest challenges that we've always had with all our outbreaks is our ability to inform the public responsibly about what is happening. To inform the public such that they are up to date with what is happening, but at the same time, not panicking. To inform the public such that their response is constructive and helps us with our response. To this end, we have also started working and talking around the concept of risk communication. We are trying to develop capacity in risk communication, and I hope that some of the lessons that you learn from here will be about around the area of risk communication, your ability to talk to the public. Koika's commitment to socio-economic development of the Fijian government through individual and organizational capacity building has been exemplary. Since 1991, 613 fellowship participants from the Pacific region have benefited from short-term and long-term training programs offered by Koika. We stand here today as a testament to the positive impact that these programs have had on our healthcare professionals and our overall health system in Fiji. As we embark on this transformative journey together, I encourage each participant to seize the opportunity to learn, grow, and collaborate. Your role as healthcare professionals and public health officials is pivotal in safeguarding the welfare or well-being of our nation. The knowledge and expertise that has been gained during this training will not only benefit you personally, but will also have a profound impact on the health and the lives of your fellow Fijians. In conclusion, I extend my sincere appreciation to Koika for their continuous support, donations, and funding that have enabled us to undertake such vital initiatives. Let us embrace this partnership with renewed enthusiasm and commitment to building a healthier, stronger Fiji. I wish you all a successful and enriching training program. Together, let us work tirelessly towards a future where every Fijian enjoys good health and well-being. Unawalevu, Danyapad, and thank you.